With my students, like I really enjoyed seeing them come together and work on the final proposal. They were such bright minds, and just being around them even inspired me.
The hospital visits were so interesting to me because as someone who visits hospitals like due to family, it's really eye-opening to see what the other side is like.
On the last day, after the proposals, my group and I were talking, and they're just all so happy about the presentation they created. And even though they weren't the winning group, I was very proud of them, and I think they did amazing, and I think they would be great leaders in the future.
I extremely liked the trip to the hospital because it showed the intricacies of the processes of what healthcare professionals actually do, what happens in those types of facilities, and to see actual patients go across the rooms was actually really inspiring, really informative to me. And to see directors talk about how they implemented AI into these hospital settings just really amazed me.
My group was working together. They definitely bonded a lot. They were super excited, super motivated to present. They had lots to say. They are very talented students, and it was an honor to work with them.
And we got to witness chart watch, which was really interesting.
I liked seeing how they had developed this not only collaboration but also friendship, and they were able to work really well together and put together a really nice proposal.
The trip to St. Michael's Hospital. That was a lot of fun to just see the in and outs of a hospital, seeing all these different levels, how they cooperated, how the people were running by left and right, and just generally the trip there was really nice in a very different way to what we've usually been doing of the classroom setting.
I really want people to join this program. It's really eye-opening. It provides insight on various different aspects of public health if you want to do public health. The workers here are extremely fun. They provide us with various activities that keep us learning, keep us engaged all the time.
By attending this program, they get to learn a lot about social determinants of health and other factors that contribute to healthcare.
Public health is not just based on healthcare. It's not just doctors or nurses or clinicians. It expands much more. There's a lot of tech that's integrated into public health, law, decision making, even business, and engineering, etc. And I think this program is such a diverse program.
This program provides such a great networking opportunity. Students get to meet so many professionals in healthcare who are in the field, and you get to meet them and and ask questions.
You get to see and feel more what it's going to be like being in public health. It really, really does give you a feel of how public health feels. So you can get, a better grasp of, hey, do I really want to do this when I grow up?
I think this program is really great because it puts students outside of their comfort zones in the sense that they have to work in groups with people they have never met or gone to school with. And in addition to that, throughout learning about the different career paths and niches that fall underneath public health, I think that this is really eye-opening for students to look into careers that are not just centered on and focused on healthcare, but also within public health.
Dalla Lana program is special because it takes months of academic content and it puts it all into 1 week. And this is really important because students are transitioning from high school into the university setting and professional settings. And it's really important because universities like the University of Toronto value academic rigor. This program really helps them transition from the high school setting to the academic setting.
This program is a very great way to branch the different opportunities that you want to get, different networking, and overall it's a really great experience.